Welcome to another episode of Med Madness. Today, we're diving into a crucial topic for medical students and professionals alike, constrictive pericarditis. Understanding this condition is vital as it can significantly impact a patient's quality of life and requires timely intervention. In this podcast, we'll cover what constrictive pericarditis is, its causes, clinical presentation, diagnostic methods, treatment options, and a real-world case study to bring these points to life. Constrictive pericarditis is a condition characterized by scarring and loss of elasticity of the pericardial sac, which restricts the heart's ability to fill properly during diastole. Common causes include recurrent idiopathic or viral pericarditis, cardiac surgery or radiation therapy, and tuberculous pericarditis, particularly in endemic areas. The pathophysiology involves a thickened and often calcified pericardium that limits diastolic filling, leading to right-sided heart failure and subsequent symptoms. Next, let's discuss the symptoms and clinical presentation. Patients with constrictive pericarditis commonly present with fatigue, dyspnea on exertion, peripheral edema, ascites, and hepatic congestion. Physical examination findings include elevated jugular venous pressure, JVP, with USMLE sign, a pericardial knock in early diastole, and a prominent Y descent of the JVP waveform. These signs and symptoms reflect the restriction of venous return to the right side of the heart due to the inelastic pericardium. Moving on to the diagnosis. Diagnosing constrictive pericarditis involves several methods and tools. An ECG may show low-voltage QRS complexes. Chest X-rays or CT scans can reveal pericardial calcification. Echocardiography typically shows biatrial enlargement, normal ventricular wall thickness and cavity size, increased pericardial thickness, and abnormal septal motion. These diagnostic tools help confirm the presence of a thickened and fibrotic pericardium affecting cardiac function. Now let's cover management and treatment. Treatment for constrictive pericarditis includes both medical and surgical options. Diuretics can provide temporary relief by reducing fluid overload. However, the definitive treatment is pericardiectomy, the surgical removal of the stiff and fibrotic pericardium, which restores ventricular diastolic function. It's also important to consider lifestyle modifications and preventive measures, such as managing underlying conditions and avoiding known risk factors. Let's consider a case study to illustrate this condition. A patient, a survivor of Hodgkin lymphoma treated with mediastinal irradiation, presents with fatigue, dyspnea on exertion, peripheral edema, and ascites. Physical examination reveals elevated JVP with USMLE sign and a pericardial knock. Diagnostic imaging shows pericardial calcifications, and echocardiography confirms increased pericardial thickness and biatrial enlargement. The patient is treated initially with diuretics for symptomatic relief, but eventually undergoes pericardiectomy, leading to significant improvement in symptoms and cardiac function. To conclude, constrictive pericarditis is a condition that can severely impact patients if not diagnosed and managed promptly. Early recognition and treatment are essential to prevent complications and improve outcomes. Don't forget to engage with our pre- and post-podcast quizzes and use our Anki flashcards to reinforce your learning. Thank you for joining us on Med Madness. Stay tuned for more episodes designed to help you excel in your medical studies and practice. Thank you for listening to Med Madness. Let's change the medical education system one podcast at a time. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io UTM_source =11labs_GPT